Welcome, welcome, welcome everyone to another Friday class. I'm excited to see you here. Here we have a few more people jumping on. It is the last day of June. How are you feeling on this Friday? Hey, Christy Perez, I see you there. It's hot.
Hi.
It's hot where I am, but I am still showing up because this is what I do on a Friday afternoon at 3, right? I'm committed, I show up, and I'm so glad and appreciative that you have decided to show up to learn more about how to use doTERRA to create a healthy lifestyle. And so here we have the opportunity to inspire one another to create this wonderful community with like-minded people and who are interested in creating a healthy lifestyle. So our topic today is first aid and essential oils. So in the chat, start dropping down any oil that you think should be in your emergency kit, and perhaps the reason why. As we move through the information, your mind might go to a specific oil, like tea tree for anti-infection purposes. I see people dropping things in the chat. On Guard, excellent, yeah. I never leave the house without helichrysum and myrrh for all types of skin issues and blood concerns. So few things are worse than finding yourself in an unprepared situation, especially if it's an emergency or where it's a first aid situation, right? And even when it's just something small, like a scraped knee at a playground, or a twisted ankle during a sports game, or a cut or a burned finger in the kitchen, finding yourself unprepared can spike your stress levels and risk making the situation even worse. So it is important to talk about these types of things every once in a while to remind yourself, am I prepared? Do I have the proper supplies that I need if something took place, right? It's not a matter of just having first aid materials. We highly recommend investing in a first aid quality kit. I'm going to go through this in a little bit, but it's also about how to use those materials, how to stay calm, and how to really help and comfort others that really make a difference in a first aid situation. So if you're prepared and you handle the situation well, the situation may resolve into a minor incident that eventually becomes a funny story or even a bonding memory for everyone involved. However, if you are unprepared, the situation could spiral very quickly, right? Injuries may worsen from lack of proper treatment, and the memory of the incident may become a source of stress and regret for months and years to come. Ever hear of PTSD? So if we're prepared, we can be one step ahead of the game, right? And thankfully, it just takes a little time and effort and education to be prepared for first aid situations. So your essential oils and your iTovi scanner, because this class comes from the iTovi scanner blog, can help if you know when and how to use them to support basic first aid procedures. So let's tackle common first aid situations one by one, so you'll know exactly what to do when the time arises. Okay? And I love seeing the chat blow up. Your minds are already going with specific oils for certain situations. We're going to start out with minor cuts and wounds. So perhaps a nick with a razor blade or a vegetable cutting incident. Ever been there in your knee, right? I mean, in your kitchen. How about a scraped knee? Whatever it is, first and foremost, stay calm and analyze the damage. Okay, analyze the damage. Don't just jump into, oh my God, you're going to die. So there are 3 degrees of wounds. You have capillary bleeding, which is a pricked finger or a small cut or scrape. right? This is the most minor of injuries. The blood is bright red, and though it may flow out at first, it quickly slows down to a trickle, and then it stops within just a couple of minutes because your body coagulates, the blood coagulates, right? If it's working properly. So what do? First thing, apply pressure, and then a bandage, like a Band-Aid, sanitize it, wash it. Even sometimes kiss the boo-boo and send good energy over it, right? Perhaps you're taking care of somebody else, not yourself. What do? You say nice, positive things to them. So they are then more in control of their emotions, so they can calm down. Then you have venous bleeding. So you got a vein. The blood should be darker than normal, oozing out slowly but steadily. So grab something to press on the wound, preferably some gauze or a clean cloth. It may take several minutes for the bleeding to stop, so don't let the pressure go. Hold it for a few minutes, even 10 minutes. If the bleeding hasn't stopped, then move on to the next thing, like calling 911 perhaps, right? Then you have arterial bleeding, deeper cuts. If the wound has broken an artery, then it's going to be bright red and it's going to come out really fast in spurts. So yes, call 911 after applying pressure and get yourself some additional help, right? Now you might be asking the question, how can essential oils help with wounds? Well, let me tell you, I have a lot of experience with that. And Dr. Riggs himself said that it was recommended that you put lavender and helichrysum directly on the suture, post-surgery. And I have experienced that with some of my clients that had C-sections. And it helped with the pain, it helped with the healing. So in the case of any cut or wound, the first priority is to stop the bleeding. So focus on that. Once the bleeding has stopped and the healing process has begun, then your oils could come in handy. Here's 3 ways. It could help fight potential infection. It could decrease pain and inflammation. And it can promote faster healing. So, which oils should you use? Now, I know you've been dropping some in the chat, but remember, most of your essential oils have anti-inflammatory properties. So what does that mean? You can just put anything you have on it. Most times it'll work. Many have analgesic properties and wound healing properties. So don't be afraid to try them. And based on scientific research and historical precedents, our top recommendations would be tea tree, myrrh, helichrysum, and lavender. Of course, most of us here are also thinking frankincense, correct X, all these other ones, right? So remember, use your oils in any situation. So let's talk about burns for a second, right? Ouch, ouch, ouch. Burns of all kinds are nasty. But again, there's 3 types or 3 different degrees of burns. So 1st-degree burns, you're going to suffer only the first layer of the skin that's affected. It looks pink, a little raised, a little swollen, right? You kind of recognize it. You may even ignore it and say, oh, I'm okay, I don't need to do anything. But you do need to do something. To treat and remove, first of all, any clothing or jewelry, right? Run it under cold water if you can. Use a cool compress if the water irritates it. You could also possibly use a soft ice gel pack, right? You could then apply, after cleaning it, correct X. Never Neosporin, correct X. And then we have second-degree burns. Now this burn is much like a first-degree burn, but now there's blisters. So considerably worse, right? Have you ever been there before with a sunburn that blisters? There's more swelling and it may get pussy, so a little worse, right? So to treat this, you follow the same protocol. Underwater, light pressure, don't pop the blisters, right? You can put gauze over it to protect it from further sun damage or any bumping from things. But if it's a large section of your body and things go into fever or infection, then definitely see the doctor or call 911 or call your doctor for any other types of suggestions. But normally we could handle that with all of our oils. Okay, now let's talk about third-degree burns, much more severe. So the skin is charred. Pretty bad, right? Not a situation right away to dump a lot of oils on. Get treatment, but always carry your oils with you to the hospital, to the doctor, because after you get proper treatment, then you want to add oils immediately to any type of situation. Even if you're not going to apply it to the burn, you put it on the opposite side of the body. You put some on your neck, you put some on your forehead. You still have to have your oils, more to deal with the emotional factor than the healing. Okay, so you have to kind of learn where to put your oils in that whole scope of the healing process. So how can essential oils help with burns? Well, they could be helpful in relieving pain and reducing inflammation. Also, avoiding infection and any type of sensitivity, it could lower that as well. What oil should you use? Many of the same ones that we mentioned. However, try Roman chamomile. Even eucalyptus. Eucalyptus has analgesic properties, can help with pain. Frankincense, and even some people are brave enough to use peppermint. So that's just knowing your oils. If you want to try it, peppermint on a burn, right? Some people think maybe that's not going to make sense. Maybe it's going to burn it more. I would try peppermint. So use your oils in that type of a situation too. What about sprains or strains? Those could hurt quite a bit, right? That type of injury hangs out for a long time. So whether it's a twisted ankle or a wrist muscle strain, moving boxes, right? Maybe a rough landing, jumping off of playground equipment or a trampoline, it could take a while for the body to heal from something. So once again, treat with oils, but add RICE. What does that stand for? Rest, ice, compression, elevation. Okay, hope you got that. RICE, rest, ice, compression, elevation. For sprains and strains, those types of things definitely help. So what oils should you use? How about wintergreen? That'd be a good one, right? Somebody has probably already dropped in deep blue in our chat feature, right? Rosemary may not be an oil that you think of for strains and sprains, but it does have anti-inflammatory properties. So if you like the smell, go ahead and add that to your healthcare for that. Turmeric, yes, Catalina, good. Okay, let's talk about blisters. Annoying, painful skin bubbles, right? Blisters usually come about due to too much friction on the skin. Due to the friction, layers of the skin separate and the pus fills up the space in between them, right? Now we understand the urge to pop the blisters, but that's not always recommended. That could be too painful and actually increase the chance of infection and almost certainly not help with the healing process. So as hard as it may be, resist the urge to break the blisters. Tea tree for blisters, Christy says. Yep, tea tree, lavender for blisters. What other kind of oils? Eucalyptus, and some people have had success even using lemon essential oils, but also keeping in mind the photosensitivity factor, right? How about heat stroke and heat exhaustion? That's important to keep in mind since we are in the middle of summer, right? If you can't beat the heat just might beat you. So always have your peppermint on hand, like Catalina says. Heat exhaustion is a real health threat, and it can work very fast, setting in just after a few minutes in a hot enough environment. So what's worse? Heat exhaustion can escalate into a stroke if you're not careful. So you have to pay attention to your body. Heat exhaustion and heat stroke happen when, due to the body getting too hot, the body's temperature regulation mechanisms start to fail. So you'll recognize heat exhaustion by the flushed pink or red face, or cool and clammy skin, maybe intense sweating, weakness, confusion, headaches, racing pulse, diarrhea, or nausea are all symptoms. So if you've crossed the line over to heat stroke, you'll turn pale, and then you may even suffer with some seizures and lose consciousness. So it's very important to pay attention. If the victim loses consciousness, of course, 911 is the first thing, right? But before it gets to that point, or while you wait for the paramedics to arrive, and I hope you're never in this situation, but as a first responder who has had to take a few classes here and there, the first thing you want to do, of course, is lie the victim down in a shady, cool place if you can. If he's unconscious, be prepared to check their airways, monitor their pulse, and perform CPR. How many of you here have CPR training? Just drop that in the chat. I'm kind of curious, okay? Because those are really good classes to take, even if you're you're not in that type of a job situation, but just for your own personal knowledge, right? Removing loose or tight skin or excessive clothing can help. Cool them down, pat them down with a cool rag, spray them down with cool water, elevate their feet several inches. That could be helpful. And then when paramedics arrive, they will set the victim up with an IV, get them fluid, right? Awesome. Thank you for dropping that in the chat, guys. They'll get them also to a cooler environment and treat them for other symptoms that are manifesting at that time, and watch them. Okay, let's move on to another situation. Simple, we actually had a class on this, right? The top 3 oils for headaches, but it is a first aid situation. In and of themselves, headaches are more likely to be annoying than anything else. However, a headache at the wrong time could totally limit your mental capacity, and that's why it's included in this first aid class. But we already learned primary headaches, secondary headaches, and so you want to kind of take inventory of what it is and then immediately reach for your oils. We would like to say that that's a somewhat simple thing, but if you let it go for too long, then it gets even worse, right? So lavender, peppermint, basil, past tense, right? How about infections? Infections can range from a small, gross inconvenience to a life-threatening problem, especially when you're talking about infection in the feet of a diabetic person, right, who may have swollen, numb feet and not even know that there's a little prick or open in their foot. So if a wound that should be healing becomes more swollen or painful or starts leaking pus, then that's a symptom of infection. Immediately clean it, start applying your oils. I've had great success with tea tree and oregano, also cypress and helichrysum, and rosemary, and also eucalyptus. Now let's talk about shock. Okay, What is shock? Shock is the gradual shutdown of the body's vital circulation pathways. So it's especially important to know how to recognize and treat shock, as it can have a variety of different causes. And depending on the cause, different interventions may be necessary. And the further the shock progresses, the more and more unable the victim will be capable of actually helping themselves. So shock can start to set in due to an injury, a severe car accident, external or internal bleeding, physical or physiological trauma, heat stroke, an allergic reaction, heart problems, loss of bodily fluids, poisoning, and other things. So recognizing the beginning of shock with symptoms like a quick pulse and breathing, cold or clammy skin, and sweating is important. There may be agitation, anxiety, nausea, vomiting, resistance to any help, not logical thinking going on. As shock progresses, the body temperature could decrease, so skin can turn blue. The victim may lose mental function and have labored or irregular breathing, and then eventually lose consciousness. But you do have a time frame to work with the person in order to start reversing the symptoms or really slowing them down. Okay. So here again, your oils will probably be useful. I shouldn't say will probably, I know for a fact can help the recovery phase. Now you may favor circulation promoting oils like clary sage or cypress, or for some of us that just love the citrus oils, those can help as well. They relax people and they get their blood flowing properly. So what does this all have with the iTovi scanner? Well, once the emergency is settled down, you could actually get out your scanner and have someone take a scan. And it's the greatest time to actually really use those oils for that person, because it's directly related to their healing process. And I've done this a couple times and it is amazing. You get a personalized scan to help relax, manage stress, keep inflammation down, and check in with them so that they could get aligned with their body and what's taking place and speed up their recovery process. So I absolutely love using essential oils for first aid situations. Now, this is my kit. It is big. You don't have to go that big. Okay. I bought this years ago on Oil Life for $29. Most people, and I went on Oil Life, they no longer sell the big kit. They recommend a smaller kit and it's only $15. And they want you to put the like 5/8 drams of oils in there, right? But this kit has little pockets where I've put as many oils as I want in here. I have mostly the top 10 oils. So there's 2 pockets, and on the other side are gauze, ace bandages, band-aids. Of course, they have Neosporin in here, but I'm never going to use that, right? I put On Guard hand sanitizer and Correct X and all the things that I know I'm going to use for it, you know? So wrapping this up, in conclusion, right? We're coming up to our time. First aid situations can be stressful, and time is usually of the essence. So it's good to be prepared. And now you've had a reminder to go get your first aid kit ready so that you are confident to use your essential oils in any type of first aid situation. Okay. I hope that you have learned more things and you have been motivated. Now let's open it up for questions, comments, and even maybe some stories. Would anybody like to share? Just go ahead and unmute yourself and share. Go ahead, Dee.
Sorry. Can you hear me?
I can.
Okay, no, I was just gonna say I did use the lavender straight in a wound that I had because I had cut my thumb on a mandolin when I was doing some onions, and it really helped it.
Awesome. Awesome, awesome. Love that. Nympha?
I had just cut my finger just like 2 days ago. So I'm like, where's my, and I usually carry this everywhere. So I'm like taking it out and it wouldn't stop bleeding. So I'm like, you know what? I want to put some frankincense in and put some lavender in it and put it with the Band-Aid. And within a few minutes, it stopped bleeding. But and I'm like, I just put it on and I switch them and I take turns with them. But the lavender, if you put it on, it takes all the pain away right away. And then the other ones, it starts to heal it up. But I like the one you said for the iblets and the tea tree. I gotta try that because it's already starting to heal, and it actually cut like a whole layer of skin off so fast with a little blade that I was using at work, and I'm like, ah.
Yeah, right. Things can happen fast. And then you're like, uh-oh, what do I do now? Marva, you have your hand raised.
Yes, I used tea tree for a little girl. She ran and hit her lip and it was bleeding. So I asked permission from her mother to use the tea tree on there. And she was like, yeah, go ahead. And okay. And so I put it on there and it stopped bleeding right away.
Awesome. I'm glad to hear that you guys are using your oils in first aid situations and you're not afraid to ask someone else if you can help them, especially when you're dealing with a child. Go Marva. Viana, you have your hand up?
Yes, I've out here in the country, we get all kinds of scratches and bruise and things out like that. So we always have to have tons of tea tree. We do oregano a lot because internally, because we get we actually get bites, and we get bites of spiders, and they are big spiders out here. So we've noticed that the oregano seems to be helping with the inflammation of that for some. Enjoy that. But I had a side question that Zarin wants me to ask you, Moana.
Okay.
Are you ready for it?
Yes.
He woke up. He's hearing the class right now, and he woke up with a sore, and I've been giving him On Guard, and I gave him oregano, but he says, ask Mapuana what I need to do to make my throat feel better. So he's listening right now. You can answer him.
Hi, Zarin. I'm so glad that you're listening to our class and you want to use oils to take care of your throat. On Guard is usually where we start, right? But it's a blend. It's a little spicy, but if that's not working and you want to try something else, you can do peppermint or clove or cassia. You can gargle with it. Put it in a little bit of water and gargle. You could also use all of our throat drops, which would be really, really good.
Say thank you.
Thank you.
You're welcome. You're welcome. Okay, Marva, you have your hand up again, or was that from the last time?
No, it just dawned on me. I had a really weird emergency yesterday. I opened up the, we had those tins that we got on holiday about 3 or 4 years back. There's 4 tins. I had one, I was preserving it. You know how they say you have things and you just keep them in their package. Well, I had left it in the foil. So yesterday I opened it. When I picked it up, it smelled funny. I opened it up. There was mold in it. So the mold spores kind of like popped out. So the first thing I grabbed was the abode and put it in my diffuser. And then I had a mask. So I put the mask on, you know, and then the gloves and things. But I also popped On Guard in my mouth. So I would be breathing the On Guard and the abode. And after a while, I could feel, you know, the smell and stuff. And I was like, just hoping it never got into my lungs. So it was really scary.
Wow, good thinking on your part to put a boat in the diffuser. I think I would have not thought about that, but and then to use all of the other things, good for you. Good for you. Yeah, see, Joan says abode is the bomb, kills black mold. So you're safe, sister. You did good. You did good. Okay, Catalina, you have your hand up.
Yeah, I just wanted to share. My mom, she called me today and she was saying she was with some brothers earlier, and she said that she called me super excited saying, I talked about doTERRA and I offered doTERRA to some people today, some brothers. She said that one of the brothers had like a surgery on his knee or like pain in his knee, and she had her Deep Blue on her, and she was like, if you want to try it, it helps really good. And another sister had a headache, and she's like, I have an oil that can help you. If you want, you can put it on. And she was like, don't tell me it's doTERRA. I've heard about doTERRA, and doTERRA is amazing. And she showed her how to put it on, the peppermint on the back of her neck, and she immediately felt relieved. So I was like so proud of her, and she was super excited to tell me. She's like, I might have 2 more people for you. So that was pretty cool.
Very
share.
cool. Very
Mhm.
cool. Thank you so much for sharing. Yep, that's a great situation when you have confidence and you offer it to other people, right? One of the stories that came to my mind when I was thinking about this class is during COVID, I never really stopped flying to go visit friends and stuff. And, wearing the mask in a plane was stressful. And I knew that at some point in time, I would have to help somebody else, because when I flew, I usually put my AirPods on and just kind of zoned to deal with my own anxiety. But this one flight, it was me on the outside seat, then a young boy, maybe like 16, 17, and then his mother. And you could tell as soon as before we even took off, she was antsy. And so I was like, uh-oh, okay, she's nervous. Well, she starts fainting. And her son is like looking for the flight attendant. And I said, what's wrong? And he goes, I need help. I need help. My mom's fainting. And then she tried to get up and she fell. And the air flight attendants came and said, okay, ma'am. And I got out my oils. I was like, okay, let me see her. I go, honey, how many fingers am I holding up? And she told me 2, and her eyes are going like this. And I have her hand, and I'm like, okay, stay with me, stay with me. And I opened up peppermint and lavender, and I just went like this underneath her nose. And she was like, oh, that smells good. And then her eyes came back into focus, and she looked at me and she goes, what was that? And I go, keep smelling it, keep smelling it. And she was like, okay. I go, all right, you're here, you're here. And then I turned, and the flight attendant was right there with an oxygen tank. And they put the oxygen on her. And I was like, okay, you're gonna be okay, right? Well, Southwest actually ended up sending me an email thanking me and giving me extra flight miles for helping the patient or the person, because the airline flight attendants didn't get to her fast enough, right? And I was just like, oh my God, that was so stressful. I can't handle it. Then I need to use oils for myself too. So, but the trick is, again, be prepared, right? If we're prepared, we have more confidence, we can help others, we can help ourselves, we can make the world a better, happier place. All right, everybody, that's our time for today. Thank you so much for joining. Yeah. Oh, thank you, Joan. Love, love, love everything in the chat. Thank you for participating there. That's fun to see. You are welcome, Catalina, for this class. The recording will be posted on my YouTube channel today's Friday. I'm gonna give myself a day to post it there. If you care to share this information, just go there and then send it to somebody else, okay? Because it's so helpful. And so now we're gonna raffle off a product. I don't know what product, because I'm on vacation. I didn't really bring anything. So Sharon Lawson, give me a number between 1 and 12.
8.
Ah, D, you're the winner. I'll send you an oil. Okay, sweetheart? She's
Thank
excited.
you.
You're welcome, sweetie. I'll send you an oil next week when I get home. All right, everybody. Thank you so much for joining.
Bye,
We'll-
y'all.
next
Thank you,
time.
Mopo.
Bye, everyone. Thank you, Mapuana.
Bye.